Make sure they... Hey everybody, my name is Dr. Roney. This is part 2 of the series on chiropractic and the miracles that it can do for healing. So last week, if you haven't watched or you didn't watch last week, I'll just review real quick. So last week I talked about the different chiropractic patients that we have. So the one patient would come in, maybe they're healthy, their structure's really good, they just woke up with a neck issue or they lifted something and strained their back. This is somebody that we can really, work on that day. We can help stretch them out, we can help massage them, get a light manipulation, and typically within 1, 2, 3 visits, they're much better, okay? That's one patient. Second patient comes in, they have more chronic issues, which means their neck issues are long-standing, they have low back issues possibly, joint pain, etc. This is somebody that we may have to evaluate structurally. And we talked about structure dictating function. So if their alignment, their shoulders are rounded, their head shifted forward, we know that with that alignment, they may be placing up to 10 to 15 times the amount of loading stress on pain-sensitive structures. So if that's not corrected, they're going to be in constant pain because of the abnormal loading stress. So that patient may need more than just a quick adjustment. They may need rehab, what they call structural rehab, okay? So we talked about those two patients. Now the third, okay, and I told a quick story last week that initially when I did chiro, rehab, sports medicine early in my career, most people got well, but there was a segment of the population that just wasn't responding to the care. And that's when I realized, because of the amount of patients that we were seeing, they all had similar issues, the ones that weren't responding. They had autoimmune conditions. They had blood sugar instability. They had thyroid issues. They had gut issues. They had issues with adrenal malfunction, etc., hormonal imbalances. So not that every patient had all of those, but the patients that weren't responding had similar problems. So I went back to school and I started to learn what they call functional medicine. I learned how to heal these areas that were implicated in chronic pain and chronic stress, or I should say chronic pain, chronic fatigue. But then as I learned more and more, I realized that these same issues are implicated in chronic disease. So here at the Center for New Medicine, we see a lot of cancer patients, and I talk to them daily. And one thing that's common in most of their histories are these things. So I'm going to go over those. So the talk today is going to harp on and isolate and focus on the causes to chronic disease, or the causes to somebody's chronic pain or musculoskeletal issues or chronic fatigue. They're all relatively similar, okay? So let me go through what those would be. So we see patients with digestive disturbances and gut issues, whether they have bloating, irritability, constipation, diarrhea. They have some type of chronic digestive system disturbance, and I'll get into that in just a little bit. We also see patients that may have poor, what they call biotransformation of the liver, meaning they're not able to take toxins and something called xenobiotics, and I'll talk about that in a minute, and transform it into soluble waste material that can be excreted properly from the body. So if their liver is not working well, these toxins are going to increase in the body, and it's going to create inflammation. So at the end of the day, and I'll harp on this big time here, inflammation is the root of all disease, okay? So we're going to talk heavily about that as well. Next, you got gut creating inflammation, you got poor liver biotransformation creating inflammation. How about infections? So if somebody has chronic infections in their system or acute infections, it's going to be a stimulator to the immune system. So your immune system is going to increase in firing because of chronic infections. So they have to be tested for and then fixed if we're going to get the immune system regulated better, okay? Next, and not in any particular order, but we could also have blood sugar instability. So if somebody has, on labs, their glucose is rising a little bit, maybe over 100, they may have increased triglycerides because their ability, or I should back up, when they are storing glucose as fat it's broken down into fat and triglycerides. So their tris start to rise. So this is somebody who may have fatigue after meals, right? They don't process sugars well, they crave sweets a lot, or they could have what they call hypoglycemia, where they get cranky, jittery, irritable if they miss meals. So that, in general, both of those is called dysglycemia. Dysglycemia is a major inflammatory producer in the body, okay? So then we'll talk about adrenal malfunction, where your adrenals are your stress glands. So chronic stress situation, initially my cortisol, something called cortisol, goes way up, but then over time my cortisol drops and I'm now cortisol deficient, or I have functional adrenal fatigue. What's going to happen there is the body's going to start utilizing your hormones and converting them to cortisol, which means you start getting hormonal imbalances. So you get low on pregnenolone, low on progesterone, and all of a sudden you're estrogen dominant, okay? So if that is set up, your inflammation is going to be higher. Your ability at the cellular level to create proper cell function is going to be inhibited. So you set yourself up for chronic disease, okay? So adrenals and hormones play a factor. Thyroid, okay? Your thyroid in general, if your thyroid's not working well, it's the metabolic powerhouse of your body. So if your thyroid's off, you're going to have everything from poor blood flow, lack of oxygen in the system, etc. So you'll be fatigued and you'll get weight gain, and you might have constipation, right? There's a lot of symptoms as far as thyroid malfunction, but it's a main player in chronic disease, okay? We could have, let's see, methylation issues. This is a big one. This is a newer science over the last, say, decade or so. But we tend now to do some genetic testing. And what genetic testing is going to do, it's going to start looking at what we call polymorphisms, gene polymorphisms. So you have something called a genotype, and then you have a phenotype. A genotype is you have this irregular, quote unquote, irregular gene, and then the phenotype means it has expressed itself. So if the gene is expressing itself, certain pathways of biochemistry are going to be affected, and at the end of the day, it could create problems with cellular energy, for example. So the most common is something called MTHFR gene. So we have to look at those and find out if these gene expressions called phenotypes are affecting your ability to process your biochemistry, basically, okay? So in short, the things that I've just mentioned are going to be indicated in somebody that is not getting well if I'm working with them chiropractically, right? So going back to the chiropractic thing, I might be previously working on a patient, they're not getting well, they have all these things going on, and I wasn't able to help them. So you go back, I went back to school over the last 10 or 15 years, and I learned how to heal a gut. I learned how to heal, work on liver biotransformation. You learn how to regulate blood sugar naturally. All this is most natural, right? You learn how to balance hormones and regulate adrenal function, etc. The point I'm making is, if we want to get people well with chronic disease, we have to go step by step, system by system, and heal the causes of those chronic diseases. Now, we'll back up. First thing we have to do is we have to have information that leads us to areas of dysfunction, right? So I brought these, you won't be able to see them, but I just want to let you know. So every patient now that I see, I have them, chiropractically, functional medicine, doesn't matter. I have them fill out forms, okay? The forms go step by step through the stomach, okay? It asks questions about your small intestine, asks questions about your colon, okay? So let's start with the digestive system. One of the things that we need to do is break it down, because it's really a three-part system, maybe even more, but just to give you an idea. Number one, I have to understand what foods you're taking in. Are you taking in foods that are going to create inflammation in your body? That's number one. So we talk about eliminating things like gluten, soy, dairy. We talk about eliminating processed foods, sugars, etc. So we put people on a low inflammatory diet that they're able to break down foods properly, and then they're able to absorb them in their small intestine and assimilate them into their cell, which means if you assimilate properly, you're going to use that food for energy. Okay? So here's the deal. If I'm looking at the stomach and I have somebody that is having issues with hyperacidity, where they get reflux, for example, I need to understand, is it because they have not enough stomach acid? Is it because they have H. pylori, an infection in the system or in the stomach? Is it because they're not getting enough digestive enzymes, where they're eating too many cooked foods? And if you cook a food, you denature the protein. So you need to break these proteins down better. And a lot of times you need digestive enzymes. Okay? So I break the foods down here. I send them into the small intestine. So in the stomach, in general, we need to evaluate it for several different things to make sure you have what you need to break things down. Okay? That's number one. Once it gets into the small intestine, the first third is where absorption takes place. So here's what could happen. There's a concept called leaky gut. And I want to talk about this. So the wall of the small intestine should have tight junctions where only good things can get through. So the junctions are really tight, only allowing things like glucose molecules and amino acids, singular amino acids, to get through, so the cell can use them for energy. But what will happen is, if I'm chronically inflamed, as an example, these tight junctions are going to widen. And what's going to happen as they widen, and this is proven, this is not theory, the foods that I eat, if they're not broken down properly, right, they're going to start leaking through the digestive wall. Now, once they leak through the digestive wall, the problem is that the immune system looks at that and it sees it as a foreign invader, so it attacks it. And what it's going to do is start increasing your inflammatory response. Okay? And I'm going to talk about that as I wrap everything up. So leaky gut is a big deal. It can be tested, it can be looked at, and it can be worked on. So there's specific protocols that we have to use in order to get the gut healed. And what that means is those tight junctions get tight again and doesn't allow things that shouldn't get through to get through. Okay? Now, that's one aspect of it. Do you have the right flora? Do you have the right prebiotics, the right probiotics, right? Are there infections going on in that small intestine? Do you have something called SIBO, which is small intestinal bacteria overgrowth? And what that means is your bacteria from your colon basically translocates, it gets through the ileocecal valve, translocates into the small intestine. And this is somebody that when they eat carbohydrates, they blow up, okay? Because SIBO basically feeds on starchy foods, okay? So it's just, we have to ask these questions to see if you have these problems. Now, what you could also have are infections in the gut. You could have parasitic infections. You could have fungal infections. You could have candida overgrowth, right? So the digestive system is very, very, I wouldn't say difficult, but you have to know what you're doing in order to go step by step. You have to ask the right questions. Stomach questions, colon questions, small intestine questions, questions that lead you from the Pacific Ocean into a puddle of water this big. So a good clinician in general is going to ask you these questions, and then they're going to know exactly what to do. So we get somebody that brings in forms that have these questions answered a certain way, like, yes, this always happens. Well, if we see that, then our next step is we have to test for this stuff. So the idea is we have to go step by step. Forms fill out, we ask questions about the forms, then we do testing. If the testing comes up positive, then we put you on a specific protocol in order to heal that. Now, how do we know it's healed? One of two ways. Subjective, you tell us, hey, I don't have these symptoms anymore, but the most efficient way is to retest the problem. And then we can show that the problem is no longer there. That's how, in general, you can heal the gut from start to finish. But there has to be thoroughness there. So if your gut is not working well and you have some of these issues, your digestive system is 70% of your immune system barrier, right? That's a lot. So if that's breaking down, your immune system is basically breaking down as well. So when we talk about inflammation, okay, so let's back up and talk about this, because inflammation is the root of all disease. With my immune system, okay, I have certain pathways or certain cells. And I'll use an example called a T regulatory cell. The T regulatory cell's job is to direct traffic. It's telling the T cells what to do, the B cells what to do, and it's basically directing traffic, okay? And I'll explain this a little bit better. If I have an infection in my body, what the T regulatory cells do are tell the T cells, what's called the Th1 pathway, to go attack that foreign invader. Once the attack is done and the virus hypothetically is neutralized, the regulatory cells are going to tell the T cells to come back down, easy, relax. So now we're back to equilibrium. There's no overproduction of those T cells. It's back to equilibrium. Then what the T regulatory cells or the traffic cop is going to do is tell the B cells to go tag that foreign invader for future recognition. That way, if I'm exposed to that same virus, okay, I have a memory to it, so your body won't get sick. Okay, I hope that makes sense. So once that tag is done, then the T regulatory cells or your traffic cops tell them to come back down. Now we're back to equilibrium. I hope that makes some sense. Okay, now, if we have chronic fuels over on this side here, gut issues, leaky gut, food sensitivities, foods that are creating inflammation, and I have poor liver biotransformation causing toxins to build up, right? The immune system is going to attack. If I have blood sugar instability, hormonal imbalances, if I have, thyroid imbalances, etc., infections, all those things are adding to the fuel to the fire, okay? So your T regulatory cells start to become drunk. So the traffic cop becomes drunk. Okay, this is what happens. This is critical, so I want you to understand this. If that traffic cop becomes drunk, I'm no longer basically controlling the T cell, B cell regulation, and things go haywire. This is called immune system dysregulation. So if I get an overactive T cell response, this is somebody that is not, they don't get sick much, but they feel lousy constantly. Okay, just as an example. So if that starts to happen, I'm going to get confusion of my immune system cells. So for cancer, as an example, if I have these tumor cells, which I'll back up and say this, your research shows you have cancer cells in your body at all times. They say up to 10,000 or more at a time. It's the body's and immune system ability to recognize them and kill them via something called cellular apoptosis. Okay? It basically recognizes bad cells and it kills them. If your regulation, your T regulatory cells, are not doing their job and they're drunk, we get chaos. Okay? And now your body starts to attack good cells, say the thyroid in Hashimoto's, right? It's an autoimmune condition, and it lets the bad cells keep replicating. So immune dysregulation or inflammation, however you want to put it, is a key catalyst to why somebody's going to get ill, okay, and chronically diseased, like cancer. Catalyst. So again, all that immune system dysregulation happens as a result of the fuels that we listed over here. We just mentioned gut, talked about the liver having the inability to biotransform and get toxins out of your system regularly, right? So I'll give you a quick note on that. We have patients that come in that may have increase in heavy metals, for example, right? Their partner, for example, husband, wife, kids, are basically in the same environment as them all day long. Yet one has heavy metals and the other three don't, hypothetically, in a family. Well, what's the variable? It's the same exposure, right? It's the liver's inability to do biotransformation. That's the problem. That person's liver is not working as well as it needs to work. So we have to address that ability to biotransform. It's called phase 1 and phase 2 liver detoxification. Okay? So we need to clear that process and those pathways to allow that to happen. All right? So again, fuels, gut, liver. What about if there's infections constantly, right? What's that going to do to this immune system? It's going to cause it to overwork chronically. And when it overworks chronically, it starts to get confused, right? It dysregulates. So these chronic infections, if I'm dealing with somebody that has chronic musculoskeletal issues, chiropractically, or a cancer patient, it's the same thing. I have to eliminate the causes as to why they've gotten this cancer or this immune dysregulation. So infections, we have to eliminate infections. So we have to test for them, and then we have to eliminate them. Hopefully that makes sense. Now the good thing is, once we regulate the body and we get equilibrium in the immune system and we take away some of these fuels to the fire, the body should be able to get rid of a lot of these infections on their own or on its own, okay? So infections are a big deal. What if we have, like we talked about, blood sugar imbalances? So we get high blood sugar and then we get something called reactive hypoglycemia. If we don't eat, we get shaky, jittery, irritable, all right? That fluctuation in blood sugar is a major, major fuel to that immune system dysregulation. So if we want to get this immune system right, we've got to take away blood sugar instability, all right? And there's a protocol that we work through to get that regulated, scientifically proven, okay? And then, again, let's talk about hormonal imbalances because this is a big deal. Over 2/3 of all autoimmune cases are women. Over 2/3 of Alzheimer's cases are women. And I personally believe, and I think this is a well-accepted theory, that the hormonal imbalances create a lot of inflammation in the body, and it's a variable that affects women greater than men, okay? So why, as an example, would somebody get hormonal imbalances? Well, the number one way, pathway-wise, is what I explained a little earlier. I'm in chronic stress mode, right? So chronic stress creates cortisol production. So if you think about sympathetic overload or fight or flight. So if I'm walking down a dark alley, somebody's coming up behind me, right? I get this blood flow. I get energy, right? It's the energy that allows for somebody to lift a car off a person. That's your fight or flight mode, okay? However, if I actually fight or flight, I burn off a lot of the chemicals. I burn off a lot of the stress-induced chemistry that was created in my body. I burn that off, so I come down to equilibrium. Sympathetic, and then I get the parasympathetic, so I'm now equal, okay? However, if I'm going through a stress response every day, but I'm not burning off the chemistry, that's going to create problems. So all this chemistry is created, it's going to create issues in my body, okay? So what tends to happen in an initial stress response, my cortisol goes high. And then as it becomes chronic, the cortisol starts to go lower, lower, lower. As it goes lower, and cortisol is a hierarchy hormone, which means your body's going to try to keep up with cortisol the best it can. So what it's going to do, it's going to steal other hormones to keep up with cortisol. It's going to steal pregnenolone, which is going to drop, for most people in this chronic stress response, it'll drop their progesterone low. And when your progesterone's low, you're now estrogen dominant, okay? So let's talk about breast cancer and ovarian cancer. If you're estrogen dominant over a long period of time because of the stress response, that estrogen is very proliferative to breast tissue and it's very proliferative to uterine tissue and ovaries, okay? So your cancer risks for breast and ovarian cancer with estrogen dominance created by chronic stress is very, very high, okay? Because now you're also getting this immune dysregulation created from all that as well. So hormone imbalance is another major stimulator to this immune dysregulation that I talked about, okay? So again, we're just listing fuels over here and the fire here, okay? So there are others. We talked a little bit about genotype, phenotype, methylation, things like that. Thyroid malfunction is a big deal as well. So in these forms, we ask about all those things, okay? So again, forms filled out. Okay, what's going on with you individually, cause-wise, that's affecting your disease or your chronic pain or chronic fatigue. Then we do testing, and then we start working on step-by-step clearing out these areas with scientifically proven formulas to do so using science-based nutrition, okay? It's the formula that's the key, gang. We've got to be able to find it, and then we've got to be able to fix it, okay? So, kind of wrapping things up a little bit here. All right, I'm going to just do a recap. Number one, we have inflammation in the body with our chronic disease patients, okay? So I'll just recap a little bit. Inflammation means that I have immune system reaction, and the byproduct of that reaction are going to be certain inflammatory proteins elevated. COX-2, nuclear factor KB, these are called prostaglandins. They get elevated. And then I get elevated cytokines like interleukin 1, interleukin 6, TNF alpha, they get elevated, okay? And they start to turn on this inflammatory process. Then my gut barrier starts to break down. My blood-brain barrier starts to break down. My lung barriers start to break down. So we get barrier compromise, okay? Then are those barriers no longer protecting us from the outside world. And then we start to get T regulatory dysfunction, okay? Then we get T cell and B cell dysfunction. And then we get something called, it's pathway, they call it T17. It's your nitric oxide pathway. So your inducible nitric oxide increases and your epithelial nitric oxide decreases, okay? This is basically an out of control immune system, okay? With a lot of inflammation in the body. Now here's the key. This is somebody, okay, that as time goes on are going to be less tolerant of their environment around them. So this is somebody that may walk into a store and has strong reactions to smell. This is somebody that eats something and all of a sudden they get inflamed or they get a response. This is somebody that, you know, goes outside and breathes in the air and can't tolerate it, okay? So here's what happens. My immune system is overworking, okay? I have a threshold, immune threshold, but as time goes on, I'm losing my ability to tolerate my environment because I've lost my threshold. So now I'm right here. So if this is the threshold level, anything I do is going to set it off. Okay, so that's a person that has lost the ability to tolerate their environment around them because their immune system is way out of control. Chronic disease, okay, one of the main components of chronic disease is that what I just explained. Your immune system dysregulates, it no longer can tell good from bad, it gets confused, and it's going haywire, okay? So that's one. The causes we just went over real quick. We went over gut and digestive system health, we went over liver, we went over infections, we went over hormonal imbalances, we went over adrenal fatigue, we went over thyroid, methylation, etc. Okay? So, quick point, if we want to get somebody from point A to point B, we have to go through these things step by step, evaluate them as to how these factors are affecting you, because if you look at chronic disease, they're all implicated in chronic disease. Don't care. You can Google that and you'll read for days. Okay? The things that I just mentioned are most implicated in chronic disease or even chronic pain and chronic fatigue. So if I'm working with a chiro patient and they're not getting better, I have to evaluate them on this level, this cellular metabolic level, to heal their whole body. Okay? If I do that, then their ability to heal chiropractically or therapy-wise is going to be significantly better because their cellular level is going to be function at a higher level. So optimal function now, okay, is going to lead to optimal performance of the human body. All right? So chiro, one of two ways, functional med approach, heal the body, musculoskeletal system gets a lot better. When we're dealing with chronic disease patients, it's no different. We have to evaluate you specifically to what you have going on based on what the research shows. And then we have to go step by step to heal those systems so you no longer have causes that are creating your chronic disease. Okay? I know that's a lot, but hopefully, you know, as I explain it over and over, you can go back. This will be on recorded on Facebook. So you can go back, you can stop it, start it, you can play it out full, and you can get an idea of step by step what needs to be done, okay? If you need help, call us, right? There's multiple doctors in here that can do this for you. It's not just me. So I'm advocating a formula as opposed to just myself, if that makes sense, okay? Step by step, find it, fix it, and now you're setting your body up for an environment conducive to healing long term. That's the key, okay? Long-term healing. You maximize your upside and you minimize your downside. And that's the best you can do, but you have to have a good step-by-step formula that enables you to do that. Okay? If you have any questions, let me know. Any questions at all?
Yeah.
Do you say, okay, go ahead.
So make sure we repeat it.
Yeah, I have to repeat the question, so I will. Go ahead.
Kate asked, how do I know I have heavy metals?
Okay, so there's, the question was, how do you know if you have heavy metals? And that's a simple one. There is specific heavy metal testing that can be done. So if we suspect, hypothetically, we won't just like test for heavy metals right away in a lot of people. But if we have a form, and the form is you have acne, unhealthy skin, excessive hair loss, sense of bloating, body swelling for no reason, hormonal imbalances, weight gain, poor bowel function, excessively foul smelling sweat, for example. Those are just several of the questions. If we see answers to that are what we have threes on there, that means you always are getting those, twos or threes. We know something's going on liver-wise. But then again, if you have chronic disease, we may test for those no matter what, just to see if those heavy metals are creating your inflammation. But it's a fairly easy test to do. So that's a good question.
Next question.
Yes,
Ready?
next question.
I read about lack of exercise contributes to immunity issues. Is that true?
Yeah, this is a great question. It is true. So some of the basics, right, that I probably should have worked on with you and talked about, your basic how you eat, right? And I'll touch on this real quick. Gluten-free, soy-free, dairy-free, depending on the patient, we might go heavy plant-based with them. We could keep meats introduced into their diet with a more organic, free roaming, a lot of fruit, a lot of vegetables, a lot of good fats. So my concept with eating is stay around the perimeter, and if you can't pick it or chase it, then don't worry about it. Now, with each individual, we can get a little more technical with that, but you have your good foods that are going in. They're going to be broken down better. They're going to be assimilated or absorbed and assimilated better with low inflammation, all right? Number two, plenty of water, right? Half your body weight in ounces is a rough estimate. If you're an athlete, maybe a little bit more. If you're not as active, maybe a little bit less, but that gives you a starting point. Your exercise, okay? It's critical because I didn't mention this, and this is something that once I get people starting to feel better, I implement. But here's the strategy. 7 to 10 minutes of intense exercise is excellent to increase your immune system capability. So what it does, it fires up this T regulatory cell. It sobers it up so it can control traffic much, much better. Okay? So 7 to 10 minutes of intense exercises. Some people can only handle 3 minutes. That's fine. Okay? Some 5, some 7. We work them up to about 10 minutes, but no more. It doesn't mean you can't do other low intensity exercises, but each time you work out 3, 4, 5 times a week, we want to work you into that intense level. So real quick, not to give away the farm here, but the way you figure out your intense level, it's the number 220 minus your age, okay? You get a number, and then you times that by 0.75, 0.8, 0.85. If you're just starting out, go with 0.75. So 220 minus your age times 0.75 will give you your minimum intense range. Keep your heart rate above that for 3, 4, 5 minutes if you can, and then we'll work you up to about 7 to 10 minutes. That is excellent for your immune system. So if you're not doing exercise, you're definitely not stimulating your immune system properly, and it's a major factor. Dormancy is no good. Your body loves motion. Motion is life. Always remember that. If I'm moving, if I'm grooving, I'm stimulating my brain. My joints are mechanoreceptively feeding my brain, and I'm getting good function as a result of that. So exercise, very important. Good question. All right.
Asking where we're located.
Okay, so we're at 6 Hughes Drive in Irvine, California. So if you're watching this from afar, we also can do Skype sessions. We can work with you from afar when we're talking about metabolically. Now, obviously, if I have to do hands-on work, that won't work, right? That'd be really special if I could do that. But so metabolically speaking, if we're talking about chronic pain or chronic disease or chronic ailments or chronic fatigue, right? Chronic pain, we can work metabolically from a distance. So the phone number real quick, I'll give you that 949-680-1880 is the phone number in case you wanted to just find out more about how to get started on a process of healing metabolically. And we can do that from anywhere in the country and foreign too, internationally I should say too.
Another question is,
Yeah.
how do you know if your hormones are low?
Okay, so some of the questions that are some of the symptoms will dictate, at least steer us in a direction. So we may have lack of motivation, we may have depression. If you're still menstruating, you'll have heavy bleeding, you might have heavy PMS, you could have irregular periods. Okay, those are signs. But then if you're weight gain, depressed, lack of motivation, if your libido's low, if there's vaginal dryness, things like that are symptoms that indicate there's a potential for hormone imbalance. So that's when we would go ahead and test those. Hopefully that answers that question.
Kitty asks, what do you do if you have trouble sleeping?
Okay, great question. So if you have trouble sleeping, there's a couple different factors, but most often your adrenals are implicated. So let me explain. So my adrenals, we talked about it, they're stress glands, right? So cortisol initially goes way up. If I have chronic stress, it's going to go way down. But either way, cortisol is responsible for something called your circadian rhythm. So here's how it works. In the morning, the sun comes up. As the sun comes up, my cortisol should shift way high. And it really does that because I start to get low on blood sugar because I fasted. I haven't eaten. Cortisol goes up, melatonin goes down, I wake up, okay? As the day goes on, it starts to drop a little bit, and then as the sun goes down at night, cortisol goes down, melatonin goes up, and then I should be able to fall asleep, roughly between 9, 10, 10:30 fairly easily, right? Especially if I'm getting up at 5:30, 6:30 in the morning, okay? And then I should be able to stay asleep through the entire night. So 1, we have a person that can't fall asleep, and then 2, we sometimes have people that can't stay asleep. So it's going to be an issue with most likely cortisol due to stress, and then also blood sugar. So the combination of those two are going to create sleep issues for people, either getting or staying asleep. So if you have that, there's Band-Aids out there. Some people take melatonin, some people take magnesium. You can take certain things, but the reality is if you have those symptoms, we need to fix them. So how do you fix them? We support adrenal function, something called an adaptogen, which helps HPT axis, and then you actually can give cortisol in supplement form, bovine cortisol, either from the medulla or the cortex, okay? So we could supplement, and that's going to help. However, always remember this, adrenal stress is always secondary to something else. It's never a primary problem. So if I just use these supplements to help you sleep, but I never correct the underlying cause, you're going to need those supplements forever. And that's not how it should be. So we don't want to think, I'm going to use this supplement for this symptom. I want to use it short term to balance you out and to help your symptoms, but I want to correct what's causing your stress that's creating your cortisol imbalance or your cortisol fatigue. Hopefully that makes sense. So this is the mentality, like a new level mentality of cause versus effect. We just don't want to use supplements just to symptomatically help somebody long term. Short term, I'm great. Same with a medication. I'm okay short term if somebody needs a medication, but these things were not designed for somebody to be on long term. They were designed for a short-term physiological change until we correct the problem. And then as we correct the problem, the supplement becomes obsolete or the medication becomes obsolete. Hopefully that makes sense. I know that's a long answer for probably a simple question, but hopefully that makes some sense.
Okay, and then the last question.
Yeah.
What do you do for leukemia?
Okay, so coming back, so the question was, what can you do for leukemia? And I apologize if I haven't been repeating the question. It's really the same concept, okay? So the idea is we have doctors here that are really, really good with treating cancer, okay? So they have protocols that can treat cancer. However, we also have healthcare providers and doctors here that can treat your causes, okay? So when we're treating the cancer properly, and they do a wonderful job here because they're super knowledgeable about how to do that, and we're looking at your causes and correcting both, now we have attempt to heal the cancer and attempt to work on the causes. So as time goes on, you get better and then it doesn't return. So that question of how it specifically, whether it's IPTs or whether it's Alcinium or mistletoe or whatever strategies a healthcare provider here would do for your specific cancer that's going to be very individualized based on what you have. So Dr. Keneally, Dr. Von Schaefer, Dr. Beta, Dr. Shannon, wonderful at working with patients that have cancer and working on protocols that can help them. So I'm sorry if I couldn't get super technical, but I know all the things that I've talked about functional medicine today are definitely something that we look for and we look at with each individual cancer patient so we can help them heal long term. But the doctors that treat cancer or work with patients with cancer here will be able to individually talk to you about that. Okay, hopefully it wasn't vague enough or too vague.
She said thank you.
Okay, no problem. Yeah, you're welcome. You're welcome. Okay, everybody good? Everybody good? Okay, all right, thanks, gang. If you need anything, let us know. We're here to help you. Hopefully this information it's helpful, right? Teaching is the key. If we can teach you and give you direction, that's the best thing I think we can do for you. What you all do with that is entirely up to you, but at least I feel like we've done our job and to try to give you answers that you might not be getting because it's just not readily out there, okay? So hopefully you learned something. If you need anything, just let us know, okay? Have a great day.